Hi, I'm Dawn Morse. I'm the founder of Core Elements Training. At Core Elements Training, we deliver an accredited day CPD course in dry cupping therapy, which is available as face-to-face or live online delivery. So in this short video, I'm going to demonstrate soft tissue release or a variation of soft tissue release and active movement to the hamstrings muscle group at the back of the leg. Okay, so we need to apply our massage medium first. Okay, so it doesn't matter which medium you use. For the purposes of today, I'm using a lotion, but you could also use oil or wax as well. So whatever you normally use within your own clinical environment. So we're going to apply a little bit more medium than we would do normally. So the medium doesn't need to be fully absorbed, but we're going to use that effleurage technique just to apply the medium, and also at the same time we're palpating the tissue and just feeling for any muscle tension here. So I've got the medium on, then I'm going to get my vacuum cups. Okay, so I'm going to place the cups onto the couch, because with the cupping variation of soft tissue release, we need to apply the cups when the muscle is in the shortened and relaxed position. Okay, so that means for the hamstring muscle group to be in a shortened and relaxed position, the knee needs to be in a flexed position. So I'm going to flex the knee, okay, or flex the client's knee. And then from here, I'm supporting the leg onto my shoulder, making sure that I've got the weight of the leg here. So making sure that the client is nice and relaxed. Then from here, I'm applying the cups to the area. Okay, so if you space those cups out more, it's going to reduce the intensity a little bit. The closer the cups are together and the more cups you apply is going to increase the intensity. Okay, so the intensity needs to be in a tolerant zone for the client. Okay, so before you start moving the leg, then check with your client, make sure that they're feeling okay. So how are those cups feeling, Katie?
Yeah, good.
Excellent. Okay, so I can see that we've got that nice lift inside the cups. I can see that some of the cups, or the colour inside some of the cups, is starting to change already as well. So I'm going to remove the bolster. I've still got a hold of the client's leg. So I'm just removing that bolster, and then from here, passively, I'm now going to extend the knee. So I'm just lengthening that leg out, okay, and then flexing the knee again. So it's quite nice to start off passively so the client knows what you're asking them to do. Okay, then once I've done 2 to 3 of those, I'm now going to allow the client to take the weight of the leg. So if you take the weight of the leg now, Katie, and if you extend the knee. Excellent. So now the client's in control of that movement. Okay. So at first they might not get full range, especially if they've had a muscle strain or they've got limited range of motion at the knee joint. Okay, but we're working towards that full range. And generally, as a rule of thumb, after about 3 to 6 repetitions, then the client should feel comfortable and they should have felt that stretch reflex kick in. Okay, excellent. Thank you. So I'm now going to remove those cups. Okay, so with this kit, I'm just squeezing the top of the valve there to reduce the suction. Okay, and now from here, I'm just going to take that leg back down again, and I'm going to flush that area through with a little bit of effleurage. And as we're doing that, we're checking to see how much tension has been reduced in that muscle group area. Okay, we're now going to go into active movement. So active movement, again, the client is going to flex and extend at the back of the knee, but this time I'm using the sliding technique. So I'm just going to apply 1 cup. Okay, and I'm going to use about 2 suctions here, but just before I start the technique, I'm just checking that I can move that cup nice and easily. So you shouldn't have to yank the cup in order to get it to move. If you have to really tug the cup or yank it, then it's too tight on that area. Okay, now what I'm going to do is I'm going to ask the client actively to flex and extend at the back of the knee. And as she's doing that, excellent, so if you can flex the knee, Katie. Okay, I'm sliding, I'm applying that sliding technique. Now we can either work longitudinally in the length of the muscle fibers or transversely, so we're going across the muscle tissue here. Okay, sometimes your clients will prefer it when you're going across in that transverse direction, and other clients will prefer longitudinal. So always ask for feedback there. And again, you're still aiming to cover the whole of that area. Excellent. Then when you finish, just ask the client to relax. And then again, we're going to flush that area through, okay, towards the hip. Okay, so I've just quickly demonstrated a cupping variation of soft tissue release and active movement on the hamstrings muscle group. If you'd like to find out more about our accredited day CPD course in dry cupping therapy, then please visit the website, which is www.coreelements.uk.com. And you could also follow our YouTube channel for more tips. Thank you.